So in the first session at this year's BTOG, we had a therapeutics discussion around precision medicine in lung cancer and how that's being taken on to the next level. So we're pretty used to being in the vanguard in lung cancer of delivering targeted therapies in targeted patient populations, EGFR, ALK, ROS1, but beyond that small family of the early, now well recognized and familiar targets, we wonder what to do with all the other targetable populations that we now have within the wider group of non-small cell lung cancer. And of course, certainly in the UK, with the genomic laboratory hub system now up and running, we're getting more and more information about that for most of our patients around this time. So the question is what to do while we don't yet have approved drugs in those settings. And across solid tumor oncology, we have a lot of good drugs now, approved and active in other situations. So for example, targeting RET or NTRK and other oncogenes in cancer. How do we get access to those beyond a compassionate access scheme with a manufacturer, which may help a patient, may well not, and doesn't allow us to learn from the process? So one of the speakers this morning, Matthew Krebs from the Christie, who is the chief investigator of the Determine trial, explained the rationale and design of that study, which is taking advantage of the fact that many patients in the NHS now have access to the profiling I was just talking about, and now through his multi-arm platform study, he calls it an umbrella/basket trial because it's across many tumor types and across many targeted therapies. That will provide a lot of opportunities for patients with solid tumors, including and in particular, I think, lung cancer.